journalism.
Amid the tragic flooding emergency in British Columbia right now, it's worth recalling that the largest freshwater system in the world is right in our backyard and under constant pressure, particularly amid climate change. Can technology make the Great Lakes smarter so that we can do a better job protecting them? We're exploring that tonight. Then, not everyone who needs dental care in this province gets it, and we'll find out why and what could be done to bridge the gaps. It's Tuesday, November 16th, and that's next on the agenda. According to satellite images, the Great Lakes are much warmer than usual for this time of year. That's helpful data we've been able to get for some time now. Smart technologies can give us even more comprehensive data, and new efforts are underway to bring those on stream to help monitor and manage this critical ecosystem. With us for more, and as is our custom, we're going to introduce our guests from furthest away to closest to our studio, starting in our nation's capital with Mark Fisher. He's the president and CEO of the Council of the Great Lakes Region and the Canadian co-chair of the Common Strategy for Smart Great Lakes Leadership Team. In Ann Arbor, Michigan, the American co-chair of that strategy, Kelly Page, who's also CEO of the Great Lakes Observing System. In Windsor, Ontario, Dr. Aaron Fisk, professor and Canada Research Chair of Trophic Ecology at the University of Windsor's Great Lakes Institute for Environmental Research. And in Keene, Ontario, that's just east of Oshawa, Barbara Mokchewenkwe-Wall, assistant professor at Trent University's Indigenous Environmental Studies and Sciences program and a citizen of the Potawatomi Nation of Shawnee, Oklahoma. And it's great to have everybody on our program tonight for, this is a subject we've returned to many times on this program, the Great Lakes, because they are so crucial to our health and future. So, Kelly Page, start us off here. Making the Great Lakes smarter. Where did this idea come from in the first place?
Sure, thanks. Well, the organization that I work for, the Great Lakes Observing System, or GLOS, we're primarily funded through the U.S. federal government to help make data that's collected in the Great Lakes through research and monitoring more broadly available to the public. And over the past 10 years, as we've been doing this, we've noticed a couple of trends. First, there's just a greater demand for data and more complex data analysis. It's not enough anymore to know what the temperature in the water is or how high the waves are. People understand that there are things like harmful algal blooms and emerging contaminants like PFAS that could potentially contaminate their water. We've also seen that people prefer to access data through their mobile devices. They don't want to go to a desktop computer and look up information on a website. They prefer to have an alert or even a push notification letting them know what's going on. So it's similar to how you might walk by a Starbucks and get a notification that there's a sale on lattes. That's how people are expecting to interact with their environment. And we thought, there's smartphones, smart appliances, even smart cities. Why not smart Great Lakes?
And has there been much uptake on it?
Absolutely. So we reached out to other organizations who we knew were also facing similar challenges reaching their stakeholders and were interested in taking advantage of these emerging technologies. And so we worked with Mark Fisher and his group, as well as the Cleveland Water Alliance, to make this idea spread throughout the region. And
we just so happen to have Mark Fisher right here on this same program to tell us why he decided to get on board after he heard about this. Go ahead, Mark.
Yeah, thanks, Steve. As we think about the region, it's home to 107 million people across the Great Lakes mega region. That's 8 states and then the provinces of Ontario and Quebec. It's a significant regional economy that represents roughly 30% of Canadian American economic activity and employment, or 52 million jobs. But at the heart of this region, as we know, are the 5 Great Lakes. 21% of the world's surface fresh water, 84% of North America's surface fresh water. In fact, it's the largest freshwater system in the world, supporting every aspect of our natural environment and our way of life. But it's a finite freshwater system. Only 1% of the waters of the Great Lakes are renewed on an annual basis by precipitation, runoff, groundwater. And as Kelly mentioned, it's under tremendous stress from rapidly changing climate to invasive species, chemical, plastic, nutrient pollution to increased urban sprawl. What's troubling is that the environmental stressors we face are growing at a rate that is outpacing our ability to understand them fast enough limiting our ability to sustainably use this resource and to protect our environment for future generations. We think that the Common Strategy for Great Lakes, for the first time, sets out a binational roadmap that we think is necessary for solving these issues across the Great Lakes in order to, really develop the information systems that will improve the way people learn about and respond to environmental change, how we inform critical policy and management decisions, but also how do we accelerate science and innovation as it relates to the Great Lakes.
Well, let's find a little bit more out about this roadmap. Aaron, smart technology in this case specifically means what?
Well, it means a lot of things. There's certainly been a real increase in the technology that we have available to us. And because of cellular networks, because of satellites, we also can now make that real time. And there's been a real push to be able to put equipment out in the water, like buoys that float and have sensors on them, or, autonomous vehicles like gliders that move through the Great Lakes and the oceans for that matter. And so all of these equipment are out there collecting data continuously, which is a really important point. In the past, when you wanted to study something like a harmful algal bloom, you had to go out on a boat and collect water. And so your sampling is both temporally limited and spatially limited. Now with all these new technologies that just sit in the water and collect the data, you get these continuous data sets. But it also, as Kelly was kind of alluding to, uploads it directly. So you can look at that data at any time. And so that helps us monitor things, get continuous data. We can actually react to stuff. And so that's really where the big change has been technologically. So this vision of having a smart Great Lakes, we now have the infrastructure and the instruments to do those kinds of things.
Aaron, follow up on that if you would. Give us a real life example whereby you got some information, it was uploaded to your smartphone or your computer or whatever. You found something out that was really helpful to you, and therefore you did something. For example.
Yeah, so we actually have a large project right now that's being funded by the Union Water Supply here in Leamington. They provide all the water to Southern Essex County and the greenhouse industry in Southern Essex County, which is the largest in North America and one of the largest in the world. So when they're taking water in, I don't think people realize how complicated treating water and providing it to the public is and how important it is. If there's a sudden shift in temperatures or even pH, or turbidity, or if there's a harmful algal bloom, they need to know that as soon as they can, because they can make changes to how they're delivering the water, how they're treating the water, how much water they're holding back. So we have NSERC funding from the Canadian government that has allowed us to put buoys out there, and we work directly with the water management, and they look at the data all the time. So we have buoys out there. They can go online on their cellular phone or through a computer and keep an eye on what the water temperatures are. And we have buoys further away that sort of give them an idea if there's water coming in from the central basin that might be low in oxygen. They know it's coming, they can make changes. So there's a on the ground affecting people's lives example of how that technology can be so powerful.
Gotcha. I read Mark and Kelly's report, and I note right high up in the report is an acknowledgement that for thousands and thousands of years, Indigenous people who have lived in and around the Great Lakes have been excellent stewards of them. And Barbara, I guess that's where you come into this conversation. What role do you see as Indigenous people playing in all of the efforts that are underway here?
Well, Steve, as you said, the Anishinaabe and the Haudenosaunee Confederacies and other Indigenous nations have been living in relationship with the Great Lakes since the time the lakes were formed, right? And long before colonial and political borders were drawn. So the Indigenous knowledge or traditional ecological knowledge that our communities hold is very deep and very broad and based on 10,000 years of observation and lived experience with the beings of the Great Lakes. So when you start to bring in this Indigenous ecological knowledge, you start to get a bigger picture and a deeper understanding and kind of different data than smart technology can access.
Well, that's what I wondered, because the Indigenous knowledge is passed down, whereas this sort of smartphone technology is all very modern and state-of-the-art. And I wonder whether these two very different types of knowledge can work together to the benefit of the public. And if it can, Explain how.
Well, certainly it can, because we get the way I like to describe it is if we look at Western scientific data, it's I guess imagine a two-dimensional circle, and you have a two-dimensional circle of indigenous knowledge, and when you bring them together, you see the whole picture. You see all of the beings that live in the Great Lakes. You see all of the different stories, lived experiences of fishers, experience of boaters, and people protecting the shoreline. And when you bring those two circles together, all of a sudden you have this sphere that you can actually kind of hold and turn in your hands and look at the Great Lakes and the environmental issues and the technologies from all directions. And you can consider data and knowledge together.
Well, Kelly, I wonder if I could get you to follow up on that insofar as I am very curious about how these two different kinds of information systems, how they can work well together. I appreciate that indigenous knowledge may go back millennia, but you guys have got sort of satellites and dealing in that kind of way. And how do these two very different worlds work together?
Yeah, I mean, I think that that's part of what I want to explore and, we hope to achieve through the Smart Great Lakes Initiative. It's not just being smart from a technology perspective. It's really thinking about that full definition of smart, being more knowledgeable, finding the most efficient and impactful approaches that you can take. For me, that includes, obviously, including the Indigenous perspective and knowledge. And so one of the things that GLOS is doing to help advance this idea is funding some projects first to support the development of an Indigenous strategy complement to the Smart Great Lakes Common Strategy to see where we can, merge the best of both approaches to help us, achieve a more enriching understanding. The other project that we're supporting is a specific research project in Lake Huron where they're doing underwater bathymetric surveys using smart technologies, but also combining that with traditional observation and community-based knowledge. It's a two-eyed seeing approach, and we hope that through pilot projects like this, we'll be able to learn more about how we can complement each other's efforts.
Okay, that's where I'm going to go back to Barb now with a real smart aleck question, which is, we're hearing all that. I mean, that's good stuff. What Kelly just said is good stuff. It sounds respectful. It sounds like an attempt to really bring these two very different cultures together. But Barbara, there is a kind of an arrogance of technology, which is it's so modern, it's so state-of-the-art, it can solve everything. And I want to know whether you really believe at the end of the day, Indigenous knowledge, Indigenous heritage, history, etc., is being respected and applied in this situation.
Most certainly it is. Kelly just gave a great example of that Lake Huron project. I am part of a research project here at Trenton University within the Indigenous Environmental Institute. And what we're starting to do is looking at literature and gray literature to see what's actually happening within Indigenous communities on both sides of the lakes, and to then reach out to those communities, to practitioners, to what we call practitioners of two-eyed seeing or other frameworks that bring those knowledge systems together, and to find out what their priorities are and how smart technologies might benefit them, and how Indigenous knowledge and understandings might benefit the smart technologies and the users of that data collected by the smart technologies.
Mark, how do you see it all working out?
Well, I think our current approaches to environmental monitoring and scientific discovery, as Aaron has said, has allowed us to be able to look backwards and describe in hindsight what happened. We are getting a lot better at being able to generate insights about those trends and to be able to explain why something happened. But ultimately, if we want to build a sustainable future, we need to be able to predict what will happen so that we can prescribe sustainable solutions and make better decisions in a constantly changing environment. And there's certainly promising work underway. For example, thanks to RBC's Tech for Nature Fund, my council is working with Pollution Probe on an integrated watershed management decision-making tool called Dexterity. The aim of the model in the user application we are developing will hopefully enable a user like a city planner to be able to describe, explain, and predict local watershed changes. This is so that sustainable development pathways can be assessed in a real-time operating environment, and potential stressors can be understood and avoided. It's certainly a novel approach, and we certainly see the promise of smart computing. There are some barriers that we need to overcome if we were to unlock its full power, including data infrastructure and particularly data governance when we think about ownership and sharing and privacy. Toronto, we know with CityLab, data privacy, data sharing was a massive issue. So we certainly hope that through the common strategy for Great Lakes, we can start tackling some of these issues. And I think to Barbara's point on the Indigenous side, in many respects, our Indigenous First Nations have been, predicting the future, because they incorporate decision-making for 7 generations. And so in many respects, they've been sort of adopting the approaches that we're trying to adopt with smart technology, but doing that in a traditional environmental knowledge way for generations. And I think there's a lot that we can learn from them.
Aaron, I want to get you back in here to talk not about water flow, but cash flow, because presumably you like that, eh, guys? I heard a couple of laughs there. This only happens, I gather, if you've got enough money to fund it. And since we're on TVO, we like to ask a lot about the O, the province of Ontario. Has there been much Ontario government funding, Aaron, that's gone towards this?
Ooh, that's a good question. I'm part of the Real-Time Aquatic Ecosystem Observation Network, which has really been a big part of Gloss and Mark and Kelly have been so supportive and important in us getting that funding. That was a $17 million grant to provide infrastructure to the Great Lakes, and about 40% of that money came from Ontario. So there's really good examples where the Ontario government has stepped up. I would argue that Canada is really lagging behind the United States in commitment to management and research in the Great Lakes, even if you correct for population. And maybe in the Great Lakes, we don't do a 10-to-1 because the number of Canadians living near the Great Lakes is not 10 times less than in the U.S. In the United States, there's all kinds of opportunities like the Sea Grant program, which every state has a Sea Grant program where you can go to get funding to work on Great Lakes issues. I think there's a little bit more infrastructure. So, professors are always asking for more money to do research and do these kinds of things. So it probably falls on deaf ear, particularly right now with everything that's going on in the world and the challenges that we're facing with the pandemic and distribution of wealth and stuff. But it would be nice if Canada more recognized how unique the Great Lakes is. And sometimes when we're applying for funding, it's a federal competition. If you apply for the Great Lakes, we get comments back like, this is a regional project. Whereas if I'm on the Atlantic coast and working on the oceans and there's only maritime universities, that's not considered regional. So the thinking has to change there. And I really like what you said about the value, and Mark has shown how important the Great Lakes is. This is it's the 4th ocean for Canada and the United States for that matter. It's really disproportionately important given our need for water and the droughts that are going on in Manitoba and across Canada and North America. We need to fund it more. We need to protect it more. We need to manage it better. So we do need a little bit more money to bring these things to fruition.
Kelly, I guess just before asking you the same question, I should point out that when we've talked about these issues in the past, many American guests came on this program and said the previous American administration was not particularly seized of this issue, to put it mildly, and therefore was not terribly interested in funding it at all. And we know about the Environmental Protection Agency and how the Trump administration tried to gut that and so on and so forth. So, question, now that Joe Biden's president, are things any better?
Well, yeah, Congress miraculously passed the infrastructure bill. And so we're all incredibly excited for that because it's obviously going to put, a lot of resources into updating infrastructure, in all sectors, including drinking water, wastewater. So this is, just an incredible opportunity for us. Specifically in the infrastructure bill, there was $150 million for oceans, coast, and Great Lakes observing, which we were thrilled about because, again, this is one of the biggest increases our program has seen, in the 10 plus years that I've been working at GLOS. But the reality is that 150 million, even though it sounds like a lot of money, and it is a lot of money, it's going to be divided across the country. So how much of that is actually coming to the Great Lakes still to be determined. And then, putting it into perspective, we did a study about what it would cost to modernize the lake bed maps of the Great Lakes, bringing everything to comprehensive, high resolution bathymetry. And that activity alone is estimated to cost $200 million. So, the investment that was just made through the infrastructure bill isn't even scratching the surface of what we really need to make sure that we have that foundational environmental monitoring that we need to be, proactive, as Mark and Aaron were talking to, instead of, always reacting to the emergency of the day.
In which case, Kelly, are you getting and or expecting some help from the private sector in all of this?
I hope so. I really see the vision of what we're doing at GLOS in terms of helping.
We should just say, you keep saying GLOS, and this is an acronym-free zone. So Great Lakes Observing System, just so everybody knows what GLOS means. Okay.
Yes. So, at the Great Lakes Observing System, we are working on helping to bring all of these disparate data sets together and available through our IT platform or information technology platform called Seagull. The purpose is not just to, provide access to that data via our website, but also to develop the back-end technology solutions so that you can access it through an app, probably developed by third-party private sector app developer who can get that information, to everyday people in the ways that they want to consume it. So, there definitely needs to be investment on behalf of the private sector to help make sure that these technology solutions are effective and reaching the people they need to reach.
Okay, Mark, we just heard from Aaron earlier that the Ontario government ponied up $17 million, but he suggested the federal government in Canada was being a bit of a laggard on this. How come? What do you think's going on?
Well, I think just to put it in perspective, right now under the Great Lakes Restoration Initiative, the United States spends roughly $350 million a year, growing to $450 million a year over the next 3 to 4 years. The infrastructure bill, as Kelly mentioned, is adding an additional $1 billion over 5 years to support Great Lakes restoration. Canada, through its Freshwater Action Plan, and this is for the entirety of the country, spends about $75 million over 5 years. So that's about $9 million for the Great Lakes. So we are way behind where we need to be in terms of protecting the largest freshwater system in the world. The Trudeau government did campaign on a more ambitious, strengthened Freshwater Action Plan, $1 billion over 10 years, which is a start. They're talking about creating an independent Canada Water Agency, which I think is a start in terms of collaboration with our provinces, our territories, our Indigenous partners, universities. So there's high potential to do a lot more. And we'll have to see what the speech from the throne and the budget say in the coming weeks. But we certainly hope that Canada will start paying attention to the Great Lakes. It is the 50th anniversary of the Great Lakes Water Quality Agreement next year. All these programs are sunsetting. And so I think this is a perfect opportunity to really catch up and be a leader in freshwater science and innovation and management where we were in the 1970s.
50th anniversary sounds like a perfect opportunity for politicians to cut some ribbons, and we know they like to do that, yes? Yeah, I agree. I see heads nodding. Okay. Barbara, let me get you back in here. I've heard this expression before, and I wonder if you could just help us understand it better. A two-eyed seeing approach. What does that mean?
Well, it's an analogy and a framework, both. It's a way of acknowledging the gifts of traditional ecological knowledge with one eye, and the gifts and the strengths of Western science with the other eye. And the ideal situation is to be able to use both of those eyes and to use both of those knowledge systems together for the benefit of all. It's a framework that was developed by Albert Marshall, Mi'kma'ki elder, back in, I think back in the early 2000s. And there's other frameworks that parallel and that use different kind of cultural terms and grounding to all bring together those knowledge systems, not to blend them, but to recognize the strengths from each one of them and look at the environmental challenges, the environmental issues from both perspectives.
Gotcha. Our time has really flown by here. We're down to our last minute. And so, Aaron, let me put this to you. This seems like a very sensible emphasis upon which to focus our efforts on the Great Lakes. But you know there are going to be some people who are saying this potentially could be a lot of money focused on very high-tech solutions which don't actually deal with the original root problems that you guys are all trying to solve. What would you say to those critics?
Well, I mean, we've done well with some things in the past, with pollution in the 60s and 70s and the dying of Lake Erie. That was almost a simpler issue that we were dealing with. We had point sources. Things are really complex right now in the Great Lakes and all ecosystems, particularly with climate change as this overriding powerful force. And things happen, Mark and Kelly both alluded to, and even Barbara did, about how quickly things are changing. We really can't deal with how quickly things are changing without better data. We've been saying this for years. So if you want to continue to have good drinking water, if you want to continue to support agricultures and recreations and First Nations groups, we need to understand the systems better. And the only way we'll do that is with better data. And so, and I think one of the really key things about GLOS and a lot of the stuff that Mark's doing is we have to bring this data together. We have to make sure that the data is compatible. We have to make sure that it's available to do these things. And that costs money, and that's difficult to do. Data management is really, really hard. So we need this stuff if we're going to continue to keep the Great Lakes healthy and sustain our ecosystem services that they provide and our standard of living.
Great discussion, everybody. Thanks so much for that. Let's thank the two co-chairs, Mark Fisher and Kelly Page, Aaron Fisk in Windsor, and Barbara Mokchawenkwe Wall, Trent University. Great to have all of you on TVO tonight. Thanks so much.
Thank you.
Thank you.
Thank you.
Thanks, Steve.
While most people don't necessarily look forward to going to the dentist, most would likely agree that it's better than not going at all. And unfortunately, particularly during this pandemic, that's what's happening for many people, often due to cost. It's got some dentists quite concerned and revived the conversation about whether dental care should be covered under the provincial health insurance system. Here for their perspectives, from furthest away to closest to our studio, as is our custom, we start in Kitchener, Ontario with Dr. Christina Heiniger. She is chair of the Political Action Committee at the Ontario Dental Association. In Mississauga, Ontario, Dr. Cal Cullen, president of the Ontario Alliance of Dentists, and in the provincial capital, Dr. Carlos R. Quinones, professor and director of the Specialty Training Program in Dental Public Health at the University of Toronto's Faculty of Dentistry. And we're glad the three of you could spare some time for us tonight on TVO. Dr. Khaled, why don't we start with you? What government-funded dental care programs exist in the province of Ontario right now?
There are three major programs, ODSP, for low-income Ontarians.
Ontario Disability Support Program.
Ontario Disability for disabled individuals. Ontario Works for what we may call welfare recipients. And Healthy Smiles, which is a program that the government set up several years ago for children who have parents with financial limitations, so they can get dental care from the local dentist, and the ministry will cover that cost.
So essentially we're talking about people who have disabilities, we're talking about people who don't have jobs, and then the Healthy Smiles are for the kids. Is that right?
That's correct.
Okay. And just basically explain how it works. If you come under one of those three, or if you are in one of those three buckets, you go to the dentist and what happens?
You need approval initially by your worker, let's say under the first two programs, or a municipal office examines you, a dental center that's affiliated with the municipal government will check the child. But essentially, you get a card or a form or a letter saying that the government will assist you with dental care. You take it to a dentist who accepts that particular program, and not all do, but you take it to a dentist who does. The dental work is completed, and the dentist files the paperwork and gets payment after a period of time.
Okay, Dr. Heiniger, why don't you pick up the story? How long do dentists typically have to wait for the government to reimburse them for the service that they provided?
Every situation is a little different for each office. If you have signed up with a direct payment, you'll get the payment within a few weeks. If you have to do paperwork and send it off, it can take longer than that.
Do you find that an acceptable amount of time to wait?
Not necessarily, because in my office, when patients come for their dental care, it's like your grocery store. You pay at the time of your dental care. And if they have dental insurance, oftentimes their dental insurance is reimbursed within 2 or 3 days afterwards.
Okay, and you just mentioned or I guess it was, Dr. Khalid, who mentioned a second ago that if you are a dentist who accepts patients who are, for example, on ODSP or Ontario Works, is that to suggest that there are lots of dentists out there who will not accept patients in one of those 3 buckets?
There will be some dentists that don't accept them. I believe at the last time the Ontario Dental Association did their survey, there was still, I'm going ballpark here, 60-70% or more that would accept those patients. The other thing is sometimes you have those patients initially and then they go on disability or they have to use Healthy Smiles for their children. So I'm sure some of most dentists would keep their patients. The patient-dentist relationship is generally strong.
All right, Dr. Quinones, maybe you could help pick up the next part of the story. Why are there apparently so few dentists? Admittedly, the majority are in, if Dr. Heidinger's numbers are right, but why would so few dentists accept patients in those 3 buckets?
So I'd actually just like to add a couple more buckets, if you don't mind,
Sure.
before I answer that question. We're also missing the Ontario Seniors Dental Care Program, which is a new program specifically for low-income seniors, which was announced roughly about 2 years ago now. And that is mostly delivered through the public sector, meaning by public health unit clinics. And then there's also services covered under OHIP, surgical dental services delivered in hospitals. So there's a variety of programs, but in general, I think we are touching upon the major ones from the point of view of dental care delivery in the private sector or private practices. Now, as to why dentists might not accept these patients, as you said, the majority still do, but there is a significant minority that don't. And I would argue that it's an issue of financing, of costs. Public programs tend to pay lower than the suggested fee schedule for dentists in Ontario, and that puts stress on dentists in terms of being able to cover their overhead costs, for example, which limits their willingness to accept such patients. We've done research in the past to ask what are the limitations here, and again, financing is important as well, which has been mentioned as complicated paperwork. And last but not least, patients, I do not like using this term, but I'll use a term that is often used, patients that are non-compliant. So I think there could be...
Sorry, what does that mean, Dr. Quinones, non-compliant?
Patients that aren't showing up to their appointments on time, patients that aren't covering or aren't following the advice given by the dentist, for example. And again, I really don't like using that term because there's a lot of things going on in these patients' lives that add good explanation for why these challenges exist. And then ultimately, what I was going to say is that there can often be a cultural disconnect between the lives of these patients and then the lives of dentists, which can create some tensions. So in general terms, I think that those are the reasons for why dentists might not always be willing to accept such patients.
Gotcha. Now let's follow up on the first part of your answer there, which had to do with the money. And Sheldon, have we got this graphic standing by? Because we want to have our viewers understand the distinction between what the Ontario Dental Association has determined the cost of various services are versus what the Ontario government is prepared to reimburse for, and we'll just do one bucket here. These are people who are part of the Ontario Disability Support Program, ODSP. So here we go. And for those who are listening on podcast and who can't see this chart, I'll read out the numbers so you can hear them. For a complete oral examination, the Dentists Association say that costs $148. However, you're only going to get reimbursed $76 by the province. Let's do another. One surface, for example, tooth-colored molar filling, $200. What's the province going to reimburse? $57. Shall we do another one? Complicated tooth extraction. Okay, the Dental Association says that costs $260 to do, and the province is going to reimburse you less than $90 for that. These numbers, incidentally, all from the Ministry of Children, Community and Social Services. We're not making them up. This is strictly from the province and from the Ontario Dental Association. So, okay, I'd like to next understand, Dr. Khaled, maybe you can pick up the story. The Dental Association says, here's what it costs to do these procedures. The province says that's all well and good, but we're only going to reimburse you this much. Why is there such a wide gap between those two numbers?
My assumption is, and Dr. Quinones will know more, but my assumption is that the ministry has limited financial capability. The Ontario budget is put out. They spend a lot of millions and billions of dollars with the Ministry of Health, obviously, and other services that the government provides. It's been many years since these fees have been increased, by the way. That's another thing you should note, that Healthy Smiles and the other programs have not significantly increased their fees in over a decade, I believe, and we all know that inflation rates are significant, especially over this last year. So I believe it's just to manage an issue of budget. Does the ministry have the funding it needs to increase these fees? That's the bottom line.
And Dr. Quinones, is that gap the reason why as many as 40% of Ontario's dentists will not see patients who are in those buckets we talked about earlier?
Well, again, I think it's more than just money. But if we're concentrating on payment, I agree. Public dental fees have not increased at the same rate as private dental fees. I'm not saying that they should, but I do think we need to think about fair remuneration for dentists in order to improve the utilization of dental care and access to dental care for these groups. But I would also say, is it really that we don't have enough money? I think there are challenges there, but I also think we need to think about political will. Is there the willingness by leaders to sort of to say we need to invest in this area? There was political will around doing something for working poor children, and that's what's resulted in Healthy Smiles Ontario. There was political will to do something around low-income seniors. That's what resulted in the Ontario Seniors Dental Care Program. And now I think, hopefully there will be political will to help address many of these issues, of which a fair remuneration is one aspect, but there are many others.
Well, let's just, before we get to the political will story, I want to understand those numbers in the first column better. So Dr. Heidegger, come on in here and say, I mean, these numbers didn't come down from Mount Sinai, right? The Ontario Dental Association, in its wisdom, determined here's what it costs to do these procedures, and the government said that's all well and good, but this is all we're going to give you. Now, how did you come up with the numbers in the first column?
Okay, so you've got two comments going on in there in that question, but the first one with regards to the fee that comes in the first column, the Dental Association for many years has put out a fee guide that is based on the economy in Ontario, and it's right across Ontario. They do analysis of dentists' submissions of their financial statements and of their overhead and of the labor costs. And every year they do an analysis and they take into account the technologies that are involved, the costs of doing their business, if there's environmental costs, or, this past year we've had the PPE added in there. And then they work their magical numbers and they come up with an increase. Surprisingly enough, a lot of the times the increase is similar to your cost of living. But that's what the increase. And some costs will increase more than others, depending on what the treatment standards are at the time. So that's where our numbers come from.
Okay, let me ask Dr. Quinones the follow-up here. Forgive me, I want to get the follow-up from Dr. Quinones, which is, okay, that's what the Dental Association says is a reasonable amount of remuneration for a service provided. Do you think those numbers are legit, or is there some padding going on, or what? You tell us.
No, I think those numbers are legitimate, but I think you have to understand when you have a provider group creating a suggested fee schedule, it's not that anybody's padding, but taking into account labor costs, capital infrastructure costs, making sure that the dental care, specifically in relation to things like COVID, is delivered safely and effectively. So we have seen increases in costs in terms of supplies like personal protective equipment and all the other things the dentists have had to do. But there's also issues of profitability, right? There's income expectations. Dentists are just like any other human being. They set targets on what they want to make, how they want to live, and I would argue that that's appropriate. Now the issue is whether the difference between the private suggested fee schedule and what public payers are willing to pay, whether that delta is challenging or problematic. We know it is for dentists. It has implications for access to care, but now hopefully we get the political will to sort of get us to a better place. So, for example, my research group did a review of public fee schedules across the country, compared them to the provincial or jurisdiction's private fee schedule. And, you get a wide range in public programs, but on average, we'll say that public dental care programs will pay anywhere between 40 to 60% of private fee schedules. It can vary quite dramatically. My sense is, and sort of the literature tends to support this a little bit. The evidence isn't great, but it tends to support this, that if you get to about 70% or just thereabouts, dentists are more willing to play ball because that's seen as fair remuneration. And dentists, remember, are trading off their professional responsibilities against this. So they'll say, yeah, I'll that's fair remuneration, and I'll do what it takes to meet my professional obligations to provide access to care for the population. So it's a set of complex issues that I think require some investigation.
All right, let's do a little real life investigation right now. Dr. Khalid, you presumably had to incur additional costs when the pandemic hit. Can you explain to us how that pandemic affected your practice?
In so many ways, to be honest. Number one, if you want to talk about additional costs, yes, we've sealed our operatories, our rooms, air filters, increased costs in PPE. So the average dental practice may have incurred costs of $20,000 to $50,000, let's say, in the initial capital improvement and then running costs. So our costs have increased, and Dr. Heidegger's right. The Ontario Dental Association does a good analysis. By the way, we actually submit anonymously, I suppose, our actual financial statements to the Ontario Dental Association, so they're not making up these numbers. They actually look at our actual financials, they look at our profit and so on, and so their analysis is quite rigorous. I must say there's a couple of things that I just want the listeners to take note of. Number one, dentists do have a responsibility to the public, and we take this responsibility very seriously. Someone told me the other day, he said to me, why don't you guys go on strike? Just like, in a sense, the optometrists are trying, I won't say they're on strike, but they're limiting their access to care, perhaps rightly. We can't. During the 3-month period when last year, or those 3 months, April, May, June, when we were somewhat closed, my office was one of the few offices open. We saw significant dental problems. I mean, people who couldn't eat, people who couldn't sleep. We diagnosed 2 oral cancers, abscesses. So we take our job very seriously. Dentists do have a responsibility to the public, and they are well aware of that. But we just feel that it may be better for the public in a couple of different ways, in many ways, if their remuneration was increased finally after decades. Someone told me that the Ministry of Health will spend $5 to $10 million on treating dental emergencies in hospital emergency rooms. And I thought, that's interesting. That's a big number. If they realized that, patients who aren't being seen at their private dentists go to the dental emergency, go to hospital emergency rooms where they receive some care. If that funding was removed from the Ministry of Budget to the hospitals and added into this program, it would probably get a much bigger return, for example.
Right. Well, first of all, we appreciate your conscientiousness staying open during that time, and I'm sure many of your patients were extremely grateful. I do want to know how did you assume a $50,000 unanticipated cost to improve your working circumstances as it related to the pandemic? That sounds like a big nut to have to crack.
In my particular office, it was $25,000. There was government grant assistance, as you may recall, for small businesses.
And you were eligible for that?
Yes, most of it's loan. I believe it's paid back over the next couple of years. First of all, the cost, as the others have noted, of PPE, a box of gloves, for example, used to cost us $25 for one of those boxes. It hit a cost of $72 during the high point of the pandemic, and we needed more of them, not less of them. Prices have come down, though, with the world kind of improving. But there is added cost. There is added cost, and again, dentists, as all the listeners know, do have above average income, generally speaking. So no one's really complaining from that point of view. We just feel that 50% of the fee is cutting it pretty tight. And as Dr. Quinones said, if it hits 70, 75%, I think more and more dentists will accept it. By the way, as Dr. Heidegger said, maybe 50 to 70% of dentists do accept public monies for treating patients, but a far fewer number of dental specialists will. It's probably closer to 5 to 10% of specialists will accept these programs. So that also limits care.
So if I understand you, dentists don't mind taking a haircut on the fees, they just don't want to take a huge haircut on the fees.
Yes, and like my hair here, yes,
Gotcha.
Exactly.
Okay, sir, that was not meant as an insult to you, I assure you. Dr. Heidegger, I want you, if you would, to comment, because we asked the Ministry of Children, Community and Social Services to participate in this program. We hope that they would give us somebody who could come on and discuss this issue with you, and they declined the invitation, which is their right to do. The spokesperson for the ministry also said the ministry doesn't track which dentists provide which services and to whom. And they did send this statement over. They said, we continue to roll out a more responsive, efficient, and person-centered social assistance system that will help individuals and the economy recover from the COVID-19 pandemic. What do you make of that?
I'm not really sure what to make of that.
Does it sound like bureaucraty's gobbledygook to you?
Yeah, I think so. I'm not sure if they were they were wanting to prove that they are looking after the situation without knowing too much what's going on about it. I'm not really sure exactly what that statement meant. Sorry.
Okay, well, I suspect you're not alone in that. Tell me this, though. Has the Ontario Dental Association tell me, how hard are they lobbying government to get some changes in the fees?
We've really picked up the I hate to say battle, but the conversation again. I mean, during COVID, we dealt with the government on different levels because of the pandemic. In September, we started with a letter saying that we wanted to meet with the Ministry of Health. Before COVID started, we had an agreement with Premier Ford saying that we would get together and try and solve this issue. We're in a campaign right now where a lot of our political contact dentists are out talking with their MPPs about this issue, discussing numbers, showing them graphs. We're trying to address the healthy smiles first, and then once we get that addressed, then we can go on to solve on the other programs that are out there.
Okay.
The hospital. Yeah, go ahead.
No, I just wanted to ask Dr. Quinones, at the end of the day, I guess this raises a bunch of questions about whether or not dental care, essentially for everybody, or at least for everybody who's not insured at work, for example, ought to just simply be included in OHIP, the Ontario Health Insurance Plan, so that going to the dentist would essentially be the same experience as going to your general practitioner or going into the hospital for a procedure, whatever. What's your view on that?
Well, as a person who specializes in public health, or as a dentist that specializes in public health, I obviously think that dental care should be included in our universal system of health insurance. But I think there's a lot of nuance here. What dental care? Where would that be delivered? I think people react to this emotionally as Canadians. Well, of course, that makes perfect sense. But I think a lot of investigation, or we need to look much more clearly at the the details here, because there is some dental care that it doesn't really make sense for it to be included in a public basket of oral health care services, for example, whereas the treatment of pain and infection, the prevention of disease, the restoring of chewing and of social function, for example, your teeth are very important for your life in general. I think the issue then becomes what services, and I think again the devil's in the details, and these are the hard types of debates that we need to have in order to arrive at a place where we could think of how might dental care be included in our universal system of health insurance, or to ask a more, I would think, a more specific question: how best to deal with dental care in Canadian healthcare policy. I caution against the idea that let's just include it, because I just don't think it's that simple.
No, I get you, but let me do a real life example here. If you have your wisdom teeth taken out and you have it done in the hospital, I presume OHIP's going to cover that and you don't have to reach into your pocket. But if you have the same procedure done in a dentist's office, I presume either you are or your own private insurer is going to have to pay for it. It's the same procedure. It's just it depends where you have it done. That's the difference in costing. Does that make sense to you?
No, it doesn't. And this is specifically getting to the point I'm saying. It's actually not a fait accompli that if you need your wisdom teeth taken out for legitimate reasons, let's just say an infection or some type of cyst or tumor, that would in any case even be done in a hospital. So if it is done in a hospital, it's not, again, a given that it's going to be covered by OHIP. But as to the issue of wisdom teeth, a prophylactic removal of wisdom teeth, or just removal of wisdom teeth for any reason other than infection or the issues that I mentioned previously, isn't necessarily indicated. So it's, again, getting at exactly what services. So let's deal with another service. If you need a root canal because you have a very serious tooth infection, to me, that is definitely within the remit of the public purse, if I could put it that way. And again, whether it's done in a private setting or in a public setting, to me, there should be some support for that, whether it's targeted to low-income individuals or people experiencing social and economic marginalization, or to everybody. I'm, of course, I'm leaning towards everybody, because this, to me, is a health concern. So just to say that it makes no sense to me and to many other people why the teeth would be excluded from this universal basket.
Right, teeth are part of health. Healthy teeth are part of health.
100%. But how it's done, I think, requires a lot of thoughtfulness.
For sure. With a few minutes to go here, okay, here's a little tricky question. Dr. Khalid, let's acknowledge that because this is now a political dispute, you need to deal with politics, and a lot of politics is optics. And I want you to speak to, if you would, the optics of reasonably well-compensated dental professionals turning away some of the most vulnerable people in our society because of a dispute over fees with the provincial government. How does that look?
Obviously wouldn't look good, but let me make that clear that in speaking to hundreds of dentists through the last few months and years, I haven't had one dentist say to me that that's the protocol they would like to use. We do not believe that withholding dental care will accomplish anything, because in the end, the premier won't suffer, the minister won't suffer. It'll be a poor individual that'll suffer. So that is not on the table as far as I'm concerned. And I honestly haven't heard any dentist even suggest that. On the contrary, as times get tougher economically in Ontario, I've had more dentists say that they wish they could see more people in need of care. There's one other point as well. The Healthy Smiles program, which is for children, it used to be called Children in Need of Treatment, is a program that was developed to protect children's health, obviously. But there is supposed to be a test of parental income. If they're above a particular level or they have dental insurance from work, they're not covered. We're finding more and more, though, that it's not well supervised. For example, I have high-income individuals coming in with their children with the documentation, so I have to provide them with half-price sort of.
How does that happen?
Care.
If they're making too much money, how do they get eligible for that?
Well, that's the question. There is, as Dr. Quinones said, the devil is in the details, really. There are ways of getting around the system we've discovered where I have, as I said, high-income, and I know they're high-income individuals bringing their kids in. They might not have dental coverage. Maybe they're self-employed, high-income individuals. So we'd like to see things tighten up a little bit, especially in the Healthy Smiles program, where really it's people who need it are taken care of. So as to your first point, as I said, and I want to make it very clear that we are not considering withholding services under any circumstance.
Well, let me follow up on that because, you talked about it already. The optometrists are in the middle of a very nasty fight with the province of Ontario as well over their remuneration, and some of them have decided they're just not taking various patients for various procedures. Go to the hospital emergency department and let them figure it out, has been their approach, and we understand. They feel they are dramatically undercompensated for services that they're providing. What have you learned from their situation?
You have to realize they are in a slightly different circumstance where they're actually not allowed to see anyone. For example, anyone above the age of 65 is covered by OHIP. Under federal or maybe it's provincial law, you cannot charge someone over 65 a fee to come to your office. Because it's a covered procedure under OHIP.
Okay, but what have you learned from their struggle that helps you in yours?
I'll give you an example. I went to an optometrist recently in Oakville. She spent over an hour with me. The bill was under $100. And I was quite surprised, actually. I felt that it was too low for the amount of work that she put in. So I do understand where they're coming from. Fortunately, very fortunately, very few people will die from poor vision. You know, I'm sure there's eye infections that optometrists do not deal with anyways. But in our case, there are cases in Canada every year where individuals do die from dental abscesses. So it's a slightly different scenario between us and the optometrists.
Gotcha. I want to thank the three of you for coming on to TVO tonight, and we now know a little bit more about not only the optometrists, but the dentists' fight with the Ontario government as well. Dr. Khalid, Dr. Heiniger, Dr. Quinones, thanks so much.
Thank you.
Thank you.
And that is the agenda for Tuesday, November 16th, 2021. Supply chains the world over are in some disarray, as you've no doubt heard. Tomorrow, we'll check in on how that might disrupt manufacturing and other sectors here in Ontario. I'm Steve Paikin. Thanks for watching TVO, for joining us online at tvo.org, and we'll see you again tomorrow.
The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.
The government still had kids in residential school. They just kept taking away our kids.
What do you want, Raina?
What do you want, Daryl? Why are you even here?
Welcome, everyone, to the future site of Casino BZ.
He's bad news. If he becomes chief, everyone will suffer.
That's my pitch. Vote for Mitch.
There's an overdose at the school. A student died. What happened?
I grew up on the res and it almost killed me.
I'm home.
Unsettled, a TVO original, continues Thursday at 9. What is the cost of glory? For Margarita Mamun, the lure of Olympic gold forces her to endure a terrible